The 988 Suicide and Crisis Lifeline has been up and running for several months now.
In this Ion Health Report, Latrice Curry talks to someone who is at the front line at a call center here in Chattanooga, working to save lives.
988 is the three-digit emergency number to connect those in need directly to a suicide and crisis lifeline. Angie Duncan with Volunteer Behavioral Health System in Chattanooga is on the front line answering that call for help.
We get calls, from people that are, depressed or actively suicidal. They may be, actually in the middle of an active suicidal, attempt. So we've helped a lot of people, just getting them immediate help.
Duncan is the crisis call center coordinator. She says every time they pick up the phone, their goal is to make sure the person on the other end gets the help they need before hanging up.
If it didn't require like immediate, EMS and police department there, then we would maybe be able to keep them online and get one of our mobile clinicians to them to evaluate them, to get them, in a facility or whatever level of care that they may need.
The pandemic brought to light something that was lurking beneath the surface. There are urgent mental health realities driving the need for crisis service across our country. In 2020 alone, the U.S. had one death by suicide every 11 minutes. And for people between the ages of 10 to 34, suicide is a leading cause of death.
We are getting more calls, it seems, from younger people, such as 13-year-olds, teens, just depressed and bullying, that kind of thing.
Duncan says some immediate warning signs to look out for are talking about wanting to die or kill oneself, looking for a way to kill oneself, such as searching online or obtaining a gun, talking about feeling hopeless or having no reason to live, withdrawing or feeling isolated, sleeping too little or too much. If you notice any of these warning signs, reach out for help. You can also call 988 to get more guidance and help on services that are available.
I always say, don't be afraid to ask the question. Ask, are you suicidal? Are you thinking of killing yourself? Because a lot of times, they need that to hear that. And then they're like, well, yeah, just never. Then it opens them up to start talking about it.
Latrice Curry with that story. The 988 Suicide and Crisis Lifeline is open 24/7, 365 days a year.